I'm excited to introduce our speakers for today's info session. First, we have Dr. Kira Werstein, Teaching Professor of Kinesiology and Health, Master of Digital Health Program Director of Graduate Education. She specializes in health, wellness, and behavior change courses. In addition to teaching, her professional mission is to translate research into practical solutions, which she achieves through various roles, including serving as a faculty member and as a clinical health coach and consultant. We will also have Dr. Kristen Metcalf, Assistant Teaching Professor of Kinesiology for the Master of Digital Health program in the Department of Kinesiology and Health at Iowa State University. Her expertise spans health and wellness, physical activity measurement, and wearable technology. We will also have Dr. Michelle Rusch, Assistant Teaching Professor of Kinesiology for the Master of Digital Health program in the Department of Kinesiology and Health at Iowa State University. She has an extensive background in using simulation in healthcare, developing mixed reality applications to offset the effects of fatigue and cognitive and visual impairments. This will be a quick informational info session on the Master of Digital Health program at Iowa State University. We've left plenty of time for questions at the end and encourage you to submit questions as they come to you using the chat feature. First, we will give an overview of the program with quick information about the curriculum. We will also discuss career opportunities in digital health, the online learning experience, student support services available to online students at Iowa State, and more. Now, let's get into it. Kira, can you start by giving us an overview of the Digital Health Master's degree?
Yes, thank you, Maddie. This program teaches students to use digital tools and data analytics to improve human health outcomes. Using information and communication technologies, it equips them with skills to manage health behaviors, illnesses, and risks. The learning objectives include integrating digital technologies into understanding digital health technologies with an expertise in human movement, health behavior, and health promotion. Students in this program will have hands-on experience. They will learn digital health tools and data analytics, and then they'll also have opportunities to work on real-world digital health projects. Now, with that, I will pass to Kristen to share more about the program's curriculum.
Thanks, Kira.
So, can I pause? Can we get the slides loaded? I noticed they're not showing on the screen.
I've got the slides on my screen.
Oh, mine aren't showing up. Okay, I'm sorry to interrupt. Proceed.
That's all right. Okay, so the curriculum. We've taken a holistic approach to the curriculum, blending technological innovation with health sciences for advanced digital health interventions. Our program is designed for working professionals, so we offer a flexible online learning format. The program involves 30 credits. So this breakdown includes 4 credits of foundational courses and 24 credits or 8 specialized courses that encompass data analytics, AI, personalized medicine, telemedicine, public health, and more. And then the final 2 credits are dedicated to a capstone project, which we'll talk a little bit more about in a bit. The 2 foundational courses are Foundations of Digital Health and Research Methods and Ethics of Health Technology, and you will find me teaching those 2 courses. The Foundations of Digital Health course explores the intersection of technology and healthcare. It covers the evolution of digital health. We discuss agile methodologies for personalized interventions, and we talk a lot about the impact of innovation and entrepreneurship in enhancing healthcare efficiency. When it comes to the Research Methods and Ethics course, it covers research methods in the digital health ecosystem specifically. We talk about quantitative and qualitative approaches. We explore ethical considerations and the ever-important regulatory aspects of health technologies. We talk about things like wearables, apps, and social media platforms. The foundational courses will set the stage for our specialized curriculum. For example, students will be inspired with concept ideas and methods for developing projects areas. This work can later be showcased in a portfolio that can help them to be competitive in the job market when they're all done with the program. The capstone project is the culminating end to the program. It's an applied experience that's designed to give students real-world exposure that's aligned with their specific career goals in the digital health field. Projects may take the form of doing an internship with industry or campus partners, a research lab, or other healthcare organizations. It could be a meta-analysis or review paper. It can be done independently or in a group, and it can be done on an existing data set or workflow improvement initiatives or solutions to healthcare delivery gaps. So pretty much the opportunities are endless here. But each project includes documentation and then a final live presentation to faculty and peers. The capstone projects are flexible and they're tailored to each individual's student interests. For those of you who are already employed, it's possible to complete the capstone through your current workplace, pending approval to ensure that it aligns with program goals. So some examples of recent student capstone projects are designing a custom digital interface to improve communication workflows in a medical office. Another student conducted user experience interviews and developed a new user interface to enhance the usability of a startup fitness company's online platform. And another student conducted interviews with patients in communities with low resources to help identify health needs and inform the design of a system for tracking health records. So these are just a few directions that current and previous students have taken, but really the capstone can be designed to fit your specific career goals and interests. So now I'm going to pass it back to Kira to talk a little bit more about the online learning experience.
All right, so as far as the time commitment for the online component, students can expect to spend about 2 to 3 hours per week for each credit. And so a 3-credit course generally takes a student about 6 to 9 hours per week. And I just want to make sure to note that that would be for a 16-week course. We're moving towards having more courses that are offered for 8 weeks. So it would be a higher number of hours per week, but then for only 8 weeks instead of a full 16-week course. And so we'll have a little bit more to come about that. Next, just sharing a little bit about the learning platform that we use, which is called Canvas. Each course will vary on the types of activities and assessments and the expectations of those. So you can expect things like quizzes, applied activities, presentations, and projects, all of which are in this Canvas platform. Students in our current cohort have interests in future careers that involve healthcare IT, health data management, data-driven decision-making, insurance, and product development and strategy. So with that, Michelle, I think we're ready to hear more about the career potential with a degree in digital health.
Thanks, Kira. So digital health has real-world applications across various sectors. Examples include enhancing patient care and operational efficiency in healthcare, developing innovative health technologies, and optimizing medical devices and systems in engineering. Our program equips graduates to be competitive and excel in various areas where health and technology converge. This degree will distinguish students in the following areas. First, you'll stand out in the area of healthcare IT and telemedicine. This involves telecare, activity monitoring, and remote medication management roles. You also gain skills with working with mHealth apps, which involves development and management of wearables, glucose monitors, activity trackers, and fitness apps. And then also monitoring services such as solutions for independent aging, chronic disease management, and post-acute care. And finally, health analytics, which includes opportunities with health insurance companies, software and product engineering, and web application development. A degree in digital health opens up opportunities for a variety of fields, from managing risk and improving health outcomes to advancing drug development and delivery. You could also have the chance to lead data-driven health research, shape impactful health policies, and promote population health and disease prevention. There are a wide variety of applications for which you can use this degree and which you will be prepared. The AMA presented a report of anticipated healthcare technology trends for 2025. They highlighted wearables, integration of remote patient monitoring into care models to facilitate chronic disease management, telehealth, tailored messaging, and AI to offset physician cognitive burden. They stress the need for thoughtful implementation of these technologies that considers people, processes, operations, and workflows required to properly integrate tools in a way they bring most value. 50 years ago, physicians often had 7 pieces of information to keep track of in an ICU visit. Now there are up to 1,300 data points to manage. Our program provides education and training on how to develop tools to collect, aggregate, analyze, visualize, and synthesize this data. These skills will help to set you apart to be competitive in the job market. Along those lines, I'll pass it now on off to Kristen to talk more about the career opportunities.
Thanks, Michelle. So the digital health field is rapidly expanding due to a number of factors, including an aging population, increased chronic disease rates, and a change in consumer expectations. Employment in healthcare occupations is projected to grow with approximately 1.8 million openings annually. And careers in health information technology are expected to grow by 16% over the next 10 years, which is much faster than the average for all occupations. 2 digital health professions are among the U.S. Bureau of Labor Statistics 2022 fastest growing occupations. The first is medical and health services managers, and this field is projected to grow 28% by 2032 and has a median pay of more than $104,000 per year. Also, the information security analysts, and this field is projected to grow 32% by 2032 and has a median pay of over $112 annually. I'm sorry, $112,000 annually. The healthcare and social assistance sectors are expected to drive employment growth in the United States, accounting for about 45% of all projected job gains from 2022 to 2032. And by 2026, which is closely closing in on us, there will be a significant shortage of health aides and medical assistants, which will make professionals with this digital health expertise exceptionally valuable. So our program prepares you to offer accessible, efficient, and personalized patient care, ensuring job security and ongoing learning opportunities in this field. We'd love for you to join us and become a leader in digital health, contributing to innovation in healthcare practices and research. So let's take a look at the return on investment that you could receive by joining us in this field. So the salary range for this field is wide, as post-program pay can vary quite a bit depending on several factors. First is your experience, also your geographical location and any previous education. All of these things can significantly influence your earning potential. However, the range also indicates plenty of room for growth as you gain experience in the field. In addition to the promising return on your educational investment, your tuition after scholarships alone would stand at $20,700, and this is a sum that could potentially be repaid within the first few years of employment after degree completion. Furthermore, if you're currently employed, you could possibly reduce your out-of-pocket costs even further. So if this is of interest to you, be sure to visit your company's benefits package to learn about any educational reimbursement plans that they may offer. Now, Maddie will round out the content portion for us today. Maddie?
Thanks, Kristen. First, I would like to let students know that there is a dedicated person in the program to help with any questions that students may have. Amanda Flynn provides student support for the program, so she'll be one of your go-to contacts, helping to answer questions and connecting you with any other university services that you might need as you navigate your time in the program. So you'll be in communication with Amanda on a pretty regular basis. Next, for student support services, admission to all graduate programs at Iowa State University does require a 4-year degree or equivalent from a regionally accredited institution. So your previous degree does not necessarily need to be in a closely related subject area. Academic records or transcripts must be submitted with your application, and the Graduate College does require applicants to have and maintain a minimum of a 3.0 GPA, but the program may alter that requirement. So if you have any questions about that, just reach out. Additionally, non-native speakers of English must demonstrate their English proficiency. This program does utilize a rapid admissions process, which means that applicants are reviewed and admitted within 7 to 10 days of applying. And they're also moving courses to the 8-week sessions, as previously mentioned. So by next fall, students will be able to enroll in 8-week sessions starting in August, October, January, March, May, or June. So right now, your first 2 foundational classes and 1 other course are already available in that 8-week format, and all other courses would be in the 16-week format. But we're working to have every course offered in that shorter option by fall of 2026. So when you're ready to apply, you can use the graduate application at iastate.edu. The application fee is $60 for domestic students and $100 for international students. If you do decide to apply to the program, the college can waive your application fee. So please reach out to Amanda at asflynn@iastate.edu before paying the fee to have it waived. I do want to add here that we've seen interest from students who are using this program as a gap year before applying to medical school. So if you're in that position or considering a gap year, this program is a great way to boost your application, dive into digital health, and build up real-world experience that'll set you apart. Students in any distance education program at Iowa State University benefit from the distance education tuition rate. So no matter where you reside, you're assessed the distance education tuition rate and a mandatory technology fee. Students enrolled in a distance education program are not charged any additional student fees, such as the activity and service fee, health fee, or health facility fees. Iowa State University offers a deferment option for employees of businesses and organizations that provide tuition reimbursement programs. If needed, you can register for the Employer Reimbursement Deferment Plan to defer payment of your tuition and fees until the end of the semester. Additionally, with this program, we're offering up to $1,800 in scholarships for students who enroll this academic year. We can get you more information about any of this if you reach out to our student services team. Finally, Iowa State University offers many academic, career, and well-being resources to support our students. From the Center for Communication Excellence to mental health resources like telecounseling and well-being coaching, we are committed to supporting your success in every aspect of your university experience at Iowa State, and we would be happy to connect you with any of these resources once you are a student.